Hi, welcome. Um, we're going to be covering shift work, sleep disorder, recognizing and improving sleep culture, something that's affecting all of us in this class in regards to sleep or lack of sleep. I want to preface this by saying that my kids may interrupt my presentation, but I'll try to cut out as much as I can. So again, shift work sleep disorder, or SWSD. We're going to be highlighting the importances for fire and EMS personnel and teaching all of us how to prioritize our sleep, our health, and our overall performance. My name's Jen Archibald. I'm in Professor Delacrosse's class, EMS P 2300. We're group 12A. So what is shift work sleep disorder? SWSD is a circadian rhythm sleep disorder. If we go back to our learning about circadian rhythm, it's our internal clock, our 24-hour clock of knowing day from night. Our bodies know that we need rest, and we go to sleep to recover and repair and wake up, hopefully feeling refreshed. But with SWSD, our work conflicts with that natural sleep cycle. And this is something that we commonly see in careers like ours that are 24-hour shifts, 12-hour shifts. They may be night shifts or rotating schedules that disrupt that circadian rhythm. So we may not get any sleep in a 24-hour period. We may be on nights trying to sleep during the day with lots of interruptions. We may even have day shift but go home pretty late into the evening trying to accomplish other things in our home, with our kids, with our family, and still trying to get enough sleep and wake up for the next day early enough to get to our next shift. And that includes anybody like us in fire, EMS, or even hospital, ER, or floor nurses. To me, looking at this clock, it's what I think of whenever I think about my 24-hour shifts. It's only 2 times a week without overtime, but I think of, so yeah, I know that it's only 2 days a week without any overtime, of course, but that 2 days turns into 4 days of exhaustion because my my shift is 24 hours on, 24 hours off, 24 hours on, and then 5 days off. But both 24 hours after each of those shifts turns into needing to rest and recover because I had zero sleep or minimal sleep on my 24 hours. So this clock feels a lot like 4 days of my week slipping away, crumbling at my hands. And I know that a lot of us may experience the same thing. So without making too many assumptions, this guy here may have had a little too much to drink, and it says good friends should take care of you when you're drunk. But would you let this guy take care of you like this? I would probably say no, and I'm sure many of you would too. And we should think about stuff like that whenever we've been awake for 24 hours and maybe trying to function the next day, maybe even being held for a period of time because nobody was there to relieve us at relief time. You're supposed to go home. Here you are, excited, and you get voluntold that you're staying an extra 12 hours, 24 hours, and you may have another shift scheduled the very next day. And comparatively, 24 hours awake is equivalent to a 0.1 blood alcohol level. And once we get into that over the legal limit of 0.08, we're starting to see decline in response time. We're seeing decline in reaction time, impairment of judgment, some aggravation, impaired judgment. We start getting some brain fog, and we may even start slipping on our protocols and making those quick decisions that are required from each of our patients. So our lack of sleep really does impact our patient care and our overall performance on and off duty. So again, to reiterate why this is important in EMS, most of our EMS operations are 24-hour models, and we don't have a designated period of sleep or a lunch break or a nap time. We're expected to respond at any moment within those 24 hours. And like I said, even after those 24 hours, we may be expected to keep moving with or without sleep. Most of the high rates of fatigue are within the fire and EMS fields because of those existing 24-hour shifts. And this directly impacts our own safety when we're trying to drive an apparatus or perform skills that may involve sharp objects. Our patients are affected by our poor decision making, and overall we are affected at home because now we're trying to rest, recover, but we still have to meet the needs of our families and our own needs within our home. We may be burnt out a lot faster, and we may be seeing a shorter career because of this. How long do you typically sleep at home? We're supposedly supposed to have 7 to 9 hours. I wouldn't know, can't relate. But how many times can we relate to going an entire 24-hour shifts, saying hi to our bed, and immediately catching a call? And after about 16 hours, you're done, you're burnt out, you feel like you're going to cry the next run. But you typically just keep your head down and keep it moving. So yeah, 8 hours, and then EMS says absolutely not, and we just take it. We take it as part of the job, and we keep it moving. But what if we start looking out for something more? So what can we look out for? Signs and symptoms for this shift work sleep disorder. Difficulty falling or staying asleep on or off duty. Excessive sleepiness while on duty, nodding off at the wheel during patient care, even at the hospital while you're trying to catch a quick break. Trouble concentrating, trying to make those decisions, and having a lot of brain farts, trying to figure it out. Increased mistakes, irritability, and sometimes wearing that exhaustion as a badge of honor. We see often whenever we brag about trying to stay awake